Okay, welcome back, class. Let's continue with oral diagnosis. Yesterday, we have gone through all diagnosis, right? Okay, so we studied definition, purpose, and then types of examination, complete screening, complete examination screening, emergency and periodic health maintenance care. And then we focused on complete examination. We had diagnostic process, including case history, clinical examination, and diagnostic aids. And then failures in diagnostic process. Then we went for case history or case presentation or history taking. We had steps from personal data, then objective and subjective. And then we had some clinical skill part, including medical examination, oral and systemic examination. And then we went for investigation and imaging studies. Finally, we made some differential diagnosis, and on the basis of radiology, we ruled out for provisional diagnosis and made a treatment plan. Then we knew something about signs and symptoms, how to ask questions in history of presenting illness, how to take pain history, what is the mnemonics occurs, and how to ask specific question for specific type of heading to get appropriate answer from the patient, and what are the essential principles, how to get past medical history and surgical history, and what are the questions to be asked in past medical and surgical history. And then medication history, past dental history specific for the dental examination and history. And then we went for family and social history, personal history, why they were involved, and occupational history comes in the personal history. Personal habits come in the personal history. And then we went for medical examination, which include specific oral examination, including extraoral and intraoral examination. And then we had a chart made by some clinicians to measure the severity of oral diseases looking intraorally via bedside oral examination. And then we had some factors to consider in ascertaining severity of the problem. This was basically part of emergency situation and emergency examination. And then we went for systemic examination, also known as review of systems, general, cardiovascular, respiratory, GI. All the systems you have already studied. So I have mentioned here so that you can have a quick revision. And then we went for general and specific examinations. The general examinations consist of temperature, body temperature, that is pulse, and then blood pressure, respiratory rate, weight, height, you can add, and then urinalysis and blood tests, including full FBC, full blood count, and then biochem, then virology, immunology, bacteriology, blood cultures, biopsy, and cytology. And specific tests, we perform sensibility testing for the teeth, application of cold, application of heat, electric pulp tester, test cavity, percussion, mobility, palpation, biting onto gauze or rubber, local anesthesia, and radiographs. If you want to study some extra, then you can go for the Oxford Handbook of Oral Medicine or Clinical Dentistry to see how to perform these tests. But because we are not, we are just medical students and we are focused as a medical student, so we have not gone in details with that. But you just know the names. You should know the names of them. And then these were some area under investigation and some radiographic views, like when we perform X-ray for chest, there is anterior posterior view and posterior anterior view, posterior anterior chest X-ray, anterior posterior chest X-ray, and then both of them, they have their own importance. Important in this graph, I told you, were sinus and sinusitis. We take occipito-mental, and also for skull and facial bone, we take occipito-mental radiographic view, X-ray view. And then we went for differential diagnosis and treatment plan. These are the suggested approach to make a differential diagnosis and then treatment plan. How you go, you finish your history and examination, and then you went for all that all the history, from personal data to chief complaint, history of presenting illness, and then past medical history, past surgical history, dental history, right? And then family history, social history, and then personal history, and then medication history. This should be on your tips of your fingers. You should remember them like you remember each other's name. Okay, you should revise them and then bring it to your practice as much as you can. So history, after history, we went for examination, specific examination, like we are talking about here oral. So oral examination, and oral examination, we already know that there are two types, extraoral and intraoral. And then we went for the review of system or system examination, all the different system, including cardiovascular, and then GU, GI, and then we go for musculoskeletal, nervous system, and renal system comes in GU, yeah. And then also orientation comes in psychological examination, evaluation, and then like this. So you go through all the review of system specific to oral, or you should say dental problems or oral cavity problems or mouth disease. And then we went for some preliminary investigations, including lab works, specific and general, which were these: investigation, general, and then specific. And then we also went for some radiographs, which included none other than like radiographs like these. And then we have x-rays and CTs and MRIs, ultrasound. And you see for the oral cavity, we just need usually we perform x-rays in certain views, like occipital and then DPT, and right. So then after performing that, we will have some differential diagnosis, and on the basis of preliminary investigation, lab results and radiographic results, we rule out our provisional diagnosis from the differential diagnosis, make the list short, and then we, according to that, make a treatment plan. Specific investigation, which will confirm or refute the differential diagnosis, and then ideally arrive at a definitive diagnosis, also known as provisional or definitive diagnosis. List in a logical progression the steps which can be undertaken to take the patient to oral health. Then you make a treatment plan and logical progression. First, okay, you tell the patient to keep your oral health, take care of your whole health, brush, floss, and this. And then you tell them the steps and you make a treatment plan. And after that, you need to execute the plan. You need to make sure the patient understands and comes for the follow-up. Then carry them out means you need to execute the plan. So now here we have a very good example from the Oxford handbook that we changed the name because we are in China. So Mr. Lee, 25 years old, an otherwise healthy young man, has a toothache. This is your observation, and this personal data: his name, age, young, and then there is no return. You should add the occupation and address, right? And then chief observation or chief complaint, it should be CC, and then pain, left side of mouth. So these are the patient's own word summarized. The patient says, I have toothache, I have pain, I have toothache, and it's on the left side of the mouth. Maybe he has not told us a lot of details. That's why we have just used CC from his own words, patient own words. Okay. Then history of presenting complaint or history of presenting illness. Second step: lost large amalgam 3 weeks ago. So there was a filling in that one of the teeth, and he lost the filling. Had twinges since then, which seemed to go away. So he has some sensation. Then so 3 weeks ago, this happened. And 2 weeks ago, toothache, twinges happened, and tooth began to throb. So there is throbbing pain. Okay. Now whole jaw aches and he can't eat on that side. Which side is that? Left side. Okay. Be aware, be attentive, so that we don't have to ask, Okay, so that which side, that side, which side, left side. It's better to write left side here. The pain radiates to ears, so there is radiation to ear, and it's worse if he drinks tea. He has foul taste in his mouth known as halitosis, little relief from analgesics such as NSAIDs or COX 1 or 2 inhibitors, whatever you take. Okay, so past medical history. After that past medical history, he looks well overall, and his past medical history is unremarkable. So there is no remarkable events happen in his uh, medically previously. So medical history and AD, nothing abnormal detected or no abnormality detected. NAF also no abnormality found. NAF, some people like NAFs and some detected. Okay, so no alarm bells on questionnaire. So past medical history, we had some questionnaire. There is, he looks remarkable well. He did not answered or recorded any of the comorbidities, and there is nothing medical history important remarkable medical history to write down. And then we have PDH, past dental history, means well there is no remarkable findings here, but is an irregular attendee, so he does not come for regular maintenance healthcare, right? And had some bad experiences, because of some bad experiences, and don't like needles. So he does not like needles, and he has some bad experience with some dentists, so that's why he's an irregular attendee. So this kind of issues, you can take the patient in confidence, talk to them, counsel them, and then maybe send them, refer to them a good dentist, then maybe these things can go away and he can become a regular attendee to a health care system. And this is also your responsibility, by the way. If you refer to someone, you will get referred. This is a two-way responsibility. Okay, nice, perfect. So now we know some of the case history. Personal data, chief complaint, history of presenting illness, past medical history, past dental history. Okay. On examination, so there should be medical history, there should be there should be family history, FM, social history, FS, and then there is personal history, FSP. There should be FSP history, there is none, so you can write FSP history none, or NAD, nothing abnormal detected. You should write, okay, this is a part of it. And then case example, okay, someone remind me to find the sheet I made during my rotation. Someone, by someone I mean Junaid. So Junaid, you later on remind me about the sheet. I need to share a sheet with you guys about how to take a history. I have made some sheet, maybe it's helpful for you guys too. You can print it out and take during your rotation. Okay, so so we have okay, thank you. So we have examination. On examination, there are extraoral and intraoral examination. On extraoral examination, medical examination inappropriate in view of PMH, and then past medical, we took past medical history and dental history. So other medical history is inappropriate, you don't need it. And some swelling left side of face due to left submandibular lymphadenopathy, because that side of the teeth was involved. So we also have involved this structure, which is left-sided submandibular lymphadenopathy. Looks distressed and anxious. The patient looks distressed and anxious from outside. Like, for example, he's sitting in front of you, have eye-to-eye contact, and then you are looking him, and whatever you can observe, you have to record in the extraoral examination, right, on the face. And then intraoral examination, you go for more, you have recorded that we have seen that there is moderate oral hygiene, not so bad, not so hygienic, generalized chronic gingivitis, no mucosal lesions, no rash, right? Sometimes we have rash, so no rash, no lesions. Caries partially erupted right side 8. So 8 right side, and it's on the lower jaw. 8 right side with pus exuding. Why, by the way, this is palmar system, palmar notation system, remember? And right side 5 large cavity. So we have also, oh sorry, We have right side, yeah, but seems periodontally sound. So there is no periodontal disease. So I mean there is no severe gingivitis or no fluctuant soft tissue swelling. So the swelling is not fluctuant, means there is no pus or fluid inside. Otherwise, it would, if there is pus or fluid, it would be fluctuant. Otherwise, complete dentition. All the secondary teeth are present with class 1 occlusion. Okay, class 1 occlusion we will see in the next slide in our dental caries. So this is intraoral examination. That's how you do the, you see the hygiene, you see gingivitis present or not, or periodontal diseases, no, or lesion, mucosal lesions, rash, if there are dental cavities, and if they are, you have to, okay, so you have to record caries partially erupted right side 8 with pus exuding. We are talking about the mandibular teeth, but seems periodontally sound, maybe mandible, maybe maxilla, I don't know. Here they have not recorded. And then right side 5 fifth, right side 5th means on the right side 5th, right? So we have patients right here, this is patient's right, this is patient left, so 5th in the row. 5th in the row means central incisor, lateral, then canine, first premolar, second premolar. So this must be second premolar. And 8 is definitely third premolar. So this guy is in 25. He has third premolar. He has the wisdom tooth, and on the right side he has pus in that wisdom tooth with caries partially erupted. And otherwise, no fluctuant soft tissue swelling, and otherwise complete dentition. All the teeth are present because we have seen the wisdom teeth. That's what I was saying that. Okay, so this is right side, yeah. This should be like this. Okay, so acute apical abscess on the right 5th and acute periodontitis seen, chronic gingivitis, periodontitis, or caries. If this is on this side, right? Remember, we remember from the yesterday's lecture. That's how we do, right? That's how we did it. Oh, sorry, I always make mistakes. That's why I did it, right? So if this is on the left side because it was making an L, this was on the right side because it's not an L. So this is left side upper and left lower, right upper, so right lower. So this is definitely this one, right? Left lower, right? So left lower 5th and left lower 8. So we should, what should we do is we should go to Zamachuya here, and we should correct. This should be left side, and this should also be left side because I don't know how to make that medical examination is face the medical examination because we have performed specific medical examination. Okay, perfect. Okay, so this should be left because we know according to the palmar rotation system, this is left 5th and left 5th is still the left sided, which one? Second premolar, and this is the third molar, right? And we have seen chronic gingivitis. We have question mark here. You need to perform some tests to confirm this, and then periodontitis, and we have some caries as we have seen at 8th, erupted caries. And then specific investigation, we need to perform vitality test. If this 5th second premolar is still vital, still living, or is dead. If it's still vital, we can do some filling, amalgam, yeah, and there are different types of amalgam, different type of filling, and we can still save that teeth. And if it's not vital, then we have to perform either root canal and cap it, or if it's too bad shape or too bad in condition, then we have to take it out. And then peri-apical x-ray for also 5th to know if it's for pattern for canal and apical area. If the canal area is patterned and apical area is still intact, Then we can go for the root canal therapy, RCT. So recipe or treatment plan. So here we did is subjective investigation and then objective investigation, and then made some assessment and then treatment. So here I should let you know about SOAP node examples. In many parts of the world during the history taking, they go for SOAP node examples. SOAP, S means subjective. So this was subjective type, all of the subjective. This is the information we take from the first-hand information taken from the patient. So this is all subjective type. And then we have an objective, which is measurable, quantifiable, and observed data. And this depends on your skills. These should be examination, like oral examination, intraoral, extraoral examination, review of system. It depends, that is objective notes. And then we have assessment. Assessment includes your differential diagnosis and some specific investigation and their results. You assess on the basis of your knowledge, and you make a list of differential diagnosis, and then you assess with the help of your abilities test, and then you perform specific tests for the patients, ask them to perform specific tests, and then still on your knowledge and abilities, you analyze the result of the test, you interpret. So that's why it is assessment. And then you assess on the basis of this, that okay, we have assessed that this should be the diagnosis because of these labs and this radiographic examination. And then finally you go for a plan, appropriate rational plan, and this includes the recipe or plan, right, and treatment plan. So what we go for this case here, we see is we perform drain for the lower left fifth second premolar via root canal. Does not require local anesthesia as the pulp is necrotic. So pulp is necrotic, the nerves are damaged, we don't need anesthesia, we do not require local anesthesia. Hence won't unduly distress anxious patient because there will be no pain, but will relieve pain and infection. This drain will relieve pain and infection because of the adjacent teeth, because adjacent teeth are still alive. But this, we don't, for this specific tooth, the pulp is necrotic, so we don't need local anesthesia. Irrigate operculum of 8. Operculum is the crown area, and whatever you can see of the third left lower premolar wisdom tooth, and you need to irrigate. What do you mean by irrigate? You water it and wash it with water, irrigation. And then, and you use antibiotics as the patient is pyretic. He has some fever. He's a male. He's on fever with 2 sources of infection, usually due to mixed anaerobic aerobic organism. Therefore, use amoxicillin and metronidazole. So we need some, for anaerobes, we need some metro, and then for aerobic, we need some amoxicillin. Okay, so this is a combination used, isn't it? Okay, so, and analgesics we need for NSAIDs for 24 to 48 hours or up to the pain. And then explain the problems and arrange a review appointment for oral hygiene instructions. You need this is an appointment where you teach patient how to floss, how to brush your teeth properly, how to take care of your teeth. So this is known as, and also the tongue, by the way. So oral hygiene instruction appointment, and then periodontal charting, and then a DPT, dental panoramic tomogram. You have to perform this X-ray view or radiographic view X-ray. Okay, so this is treatment plan, and then a future plan, of course, OHI, oral hygiene instructions, appointment and scaling, because maybe we have seen some plaque or calculus deposition. RCT for 5. Why RCT? I think it's not vital, non-vital, but not in so bad condition to take it out or excavate. So RCT, root canal treatment or endogenic treatment, we'll see later in the next slide. And plastic restoration as indicated. Post or core crown we can give after RCT, root canal treatment, we can go for a crown or a cap, dental capping. Remove third molars as indicated clinically and from DPT. This radiograph and clinically tells that the third molar was so bad in condition, we have to take it out, we have to remove it. And then treatment at the first visit is kept at minimum to relieve the patient's pain and thereby gain his trust and future attendance, because we remember this patient had some bad experience and he was afraid of needle. Is so we need to keep the treatment to the minimum to relieve patient's pain and gain his trust so that he can come for the follow-up and future attendance. So this we give a lot of time to case histories so that you can revise your history taking abilities and how to take notes. I hope you can, with this slide, you can revise some of your skills with each other and in the hospital, because this is the core examination every physician or a junior doctor should know. And this is SOAP, another type of quick way of taking notes, but subjective is still personal data. Subjective still includes personal data, chief complaint, history of presenting illness, past medical history, past medical surgical history, dental history, family, social and socioeconomic and personal history. Subjective and objective, we go for the examination, oral examination. If oral examination, extra-oral, intra-oral, and specific review of systems, specific examination, cardiovascular, genitourinary, GI, then you go for the, in case of male, prostate examination, and in female, uterus. And then depends on the patient if they have some association, otherwise no needed, colorectal no needed. And then we have some other skin dermatological examination, psychological examination, right, orientation, everything, and general examination. Do not forget general examination on review of system. General means you see overall well-being, you see the weight, height, you see just orientation, minor, okay, name, place, and this. And psychology will increase the psychological examination will include detailed psychological examination. So in general, we usually ask for orientation. Okay, the patient know, so do you know you are in hospital, and what do you think, what's the time around here? So they, without watching the voice, they say, okay, it's morning or night, maybe like around 5, and it means the patient is oriented and it's not drunk or something. And then we go for assessment. We will make a list of diagnosis, differential diagnosis, and then we also assess via laboratory lab works and imaging studies, and then make a final assessment. We take a rule out the diagnosis, we rule out on the basis of our experience and the knowledge given by the patient, and also on the basis of results of labs and radiographic results. And then we make a treatment plan. Do not forget, there is not only antibiotics or not only the drugs, but we also need some future follow-up plan. So plan includes the treatment recipe and the future plan follow-up. So this is another example of SOAP, how to take SOAP. So SOAP S contains chief complaint, history presenting and medical history, and then O is objective. Here we go for the vitals, clinical exam, extra or intra. So he has include the radiology, the previous radiology he has performed, and then endodontic testing, cold sensitivity, EPT, perception, palpation, probe, and mobility. And then we have a lot of medical history. You can see, let's go with this. Chief complaint, 23-year-old male present with a chief complaint of my lower left jaw has been sore for past few days. So why it's in inverted commas? Because chief complaint is the patient on words. So we have written in inverted commas. This is the exact sentence he has said, right, out of his mouth, directly from out of the mouth of the patient. And the history of presenting illness, then he has swelling for past 3 days, and otherwise he was previously asymptomatic. Then medical history, we have medical condition, asthma, important, medication, albuterol, he's taking as albuterol for asthma, and allergies, there is none noted. And then past surgical history, then he has some surgery, and then we have social history, he used smokes, and ETOH is alcohol. Okay, then objective examination includes vitals, clinical exam, extraoral, intraoral, and then previous radiology. Assessment, we have assessed that he is asthmatic and exercise induced asthma, and then he is smoker, and then 1 pack per day, PPD, 1 pack per day means 20 cigarettes per day. He smokes 20 cigarettes per day, but there should be more smoking history. For how many years? There should be 1 pack per day for how many years is important. Smoking history. Do you know how to take smoking history? If not, that's bad, because very important, as important as pain history, because a lot of diseases are related to smoking, persistent smoking, prolonged smoking, long-term smoking. And number 16, this is universal. By the way, this is universal. So it means, what does it mean? Anyone? Left-sided, patient left-sided, third molar, 16. And 17 is right-sided, oh sorry, still left-sided, but lower jaw, molar. So the universal notation system, universal teeth identification system. If you don't know, go back and revise. So this is, they use universal, and previously this was Palmer notation system. That's why we use this system to identify the teeth, and you do not go for the wrong teeth. They have not performed endodontic testing, and then plan, they made a plan, extraction of number 16 today, and upper colectomy for 17, number 17, and antibiotics for 10 days, penicillin amoxicillin, and extraction for 17 after the infection is gone, because number 17 has some infection. And then we will perform extraction of number 17, which is left lower wisdom teeth. Perfect. So this guy is also 23, he has wisdom teeth. Perfect. Analgesic, Motrin, Tylenol, and Percocet, okay, for pain. And then follow up, and then treatment rendered today, consent signed. And so, and some anesthesia is used, local anesthesia, lidocaine 34 mg. So they have written, this is an example of soap, not examples. In many parts of countries now, this is performed. They have pre-made this chart, and you just type in the computer, or they just write it. So I suggest you also have some of this kind of download this kind of form from online, and then you can have print it, copy it. Then it will be easier for you to take history, and you will not skip any important area, and your professor or your supervisor will be happy with you. This is 8-step self-oral cancer screening. You will do later in cancer and malignant lesions, but you can also perform for yourself. This is very famous. And a mouth cancer self-examination is easy. You can study for yourself. Thank you.